Thank you very much, Chairman Padilla, and I want to echo your remarks. We're here to discuss the shortage of healthcare workers, and yet the conversation so far from the other side of the aisle has not addressed that issue. They want to talk about border security and border safety. They're important issues. I agree with the chairman on that. But I had hoped that we would focus more of our time on actually trying to help deal with a problem that is very real across the United States, including all of our states gathered here today. I just want to note a couple things. Governor Abbott is putting recent entries into the United States, people who have passed the critical fear test, critical concern, into buses and sending them off to cities across the country without any warning. I visited one of those centers last Friday in Chicago at the Salvation Army. And let me spend a second or two thanking the people from the Salvation Army and all the wonderful charities that have stepped up to try to help these people who are in a desperate position. I'm concerned about their fate, as we all should be, but I'm concerned about the governor of Texas and his decision just to dump busloads of these people without warning into communities. We are doing our best, and we're going to deal with them in a humane and American way, but it would be helpful if they didn't become the victims in this, or pawns in this political debate at the national level. I think we ought to be a little more caring for the women and children, families, and individuals who are coming across our border and are here having been judged to be legally qualified to stay until they have a hearing ultimately deciding their fate. I met with them, I sat down, I talked to them. They're in a desperate situation. They've come, many of them, 4 or 5 months traveling to the United States, risking their lives, and many of them suffering things that none of us would want to endure. I think they should be treated in a humane American way, and that means the governor should at least give us warning if he's going to ship them off to cities around our country. Let me say back on the issue of healthcare workers. Some people look at the immigration issue and see murderers and rapists and drug dealers. What we're talking about today is looking at the immigration issue and seeing nurses and doctors and medical professionals and caregivers. They're already here, and we need more of them. I think that is a worthy topic of conversation. I traveled my state in the month of August from the city of Chicago down to the most rural areas of Illinois. The message was consistently the same. Dr. Allure, who is here today, thank you for being here, works at the Marion, Illinois Veterans Hospital, has for 11 years. I went down to Southern Illinois Healthcare, Max Buddy, met with him and talked about what they're facing. They are facing a dramatic shortage in nurses, dramatic shortage in doctors. And what we're trying to do here is to try to find a solution to this. But as long as we're stuck on the issue of law enforcement, we can't even address this. I would just say this. I'm going to go out on a limb here, and boy, I guess I could be proven wrong. But if you can show me a nurse or doctor, immigrant to this country, who is now still in immigrant status, who's committed a serious crime, I'd like to know about it. I haven't heard it. Just the opposite is true. These men and women are coming to the aid of people who desperately need medical care. And to brand them as part of the surge at the border and somehow criminal in some respects, I don't think is fair. I don't think it really addresses the reality of what immigrants bring to this country. Our immigration system is broken. And the reason we haven't changed it is not for lack of effort. Everyone gathered here today has been part of that conversation, but we're a 50-50 Senate and a 50-50 committee within the Senate. And it's difficult to find a bipartisan approach that does ring true to everyone involved in it. We've tried, and I'm afraid we haven't reached it yet, and I hope we do soon. I want to thank the chairman for identifying healthcare workers and healthcare professionals as one possibility. Wouldn't it be something if we did, before the end of the year, a bipartisan bill that brought more doctors and nurses to America where we desperately need them right now? If we put aside all our differences on all the other things and dealt with that, wouldn't it be refreshing to the American people that we get it, that we understand the message we're receiving, The American Hospital Association called the current hospital workforce shortage a national emergency. They project a shortage of 1.1 million nurses by the end of the year. By the end of the year. This is a critical emergency. To say that we have to solve the southern border crisis before we can consider allowing nurses to come to this country and care for Americans is just plain wrong. We need to deal with both, but we can deal with one immediately. The Association of American Medical Colleges estimates the U.S. could see a shortage of 124,000 doctors by 2034. That's for real. I can tell you there are many of them that are here, these physicians already serving our communities and saving lives as we speak. And many of them, unfortunately, due to the lack of available green cards, are forced to remain on temporary visas. And as the chairman has alluded, when their kids reach the age of 21, the protection that allowed them to stay with their parents in the United States evaporates, and they're subject to deportation. How would you like to be a doctor going into surgery knowing that next week your daughter, who you would give anything for, could be subject to deportation? We can fix that. That's what this committee does. This is our jurisdiction. Wouldn't it be great if before the end of the year we had a bipartisan answer to that simple challenge? I know Dr. Allure has addressed this, and he knows it personally, and we do too, from the professionals in this country. So I'm going to conclude by saying there's work we can do. There are things we can achieve, and soon. The bills that have been addressed here, the Healthcare Workforce Resilience Act, which I co-sponsored with Senator Cornyn, the Conrad State 30 and Physician Access Reauthorization Act, have more than a dozen Republican co-sponsors. You know what that means in terms of the Senate? That means we could hit the magic number of 60 and get this through. Now, there are some on the other side of the aisle, and not alluding to any person who's present here, but there are some on the other side of the aisle who want not one single immigrant to come to this country. I'm not exaggerating. They don't want a single one. They happen to believe that makes us stronger as a nation. I couldn't disagree more. I'm the son of an immigrant and proud of it. I think I'm doing a service to this country, and I hope that I can continue it. And many more just like me, sons and daughters of immigrants and immigrants themselves, want to make America a better and safer place. That's what this hearing is all about.